Introduction. If you ask, what is hip replacement? The answer would be literally to replace the worn hip with an artificial hip. Total hip replacement or arthroplasty is a common procedure in orthopedic surgery. This type of surgery is recommended to patients who have pain and stiffness of the hip due to various conditions. Total hip replacement may help in reduction of pain, improvement in sleep, physical activity, and quality of life. Structure of the hip. Before we ask how your surgeon can perform this surgery, let us see what a normal hip looks like. The hip joint comprises the following structures: head of the femur, acetabulum of the pelvis, ligaments of the hip joint. How does the hip function? Your hip is a freely moving joint that gets its movement because of the bone being attached to a socket. So, the structure of the hip is similar to a ball and socket joint. In your hip, the ball is the head of the femur and acetabulum is the socket. The head of the femur or ball of the hip joint articulates or moves within the cup-like socket called the acetabulum of the pelvic bone. Several strong ligaments help hold the head of the femur within the acetabulum. When is a hip replacement needed? The ball and socket, as we can see, are each covered by cartilage. A number of conditions and diseases can cause the cartilage surfaces to degenerate, which in turn leads to pain, stiffness, and disability. A variety of hip problems may result from either wear and tear of the hip from a lifetime of activity or from disease and injury. Some of the common hip problems leading to total hip replacement are osteoarthritis, rheumatoid arthritis, traumatic arthritis, avascular necrosis, other reasons. Am I fit for hip replacement? Routine tests have to be carried out as is done before any surgery. These tests are done to see the fitness of a person undergoing the surgery. Blood work, urine tests, ECG, and chest X-ray are the tests that may be recommended. Some individuals may be asked to have a dental checkup if they have not had one recently. What are the decisions to be made before surgery? One of the main considerations for your surgeon is the use of implant, that is, considering the various options of the artificial ball and socket joint and choosing the right one. In the past, patients had just one choice when considering total hip replacement. That was metal ball on polyethylene cup. It consists of metal stem, metal head, and polyethylene cup, usually embedded in a metal shell that is attached to the pelvis. Today, there are various options of implants. Metal on metal hip implants have metal femoral stem, femoral ball, and cup. Ceramic on polyethylene implants have metal femoral stem and a ceramic femoral head with a polyethylene cup embedded in a metal shell. Ceramic on ceramic hip components have metal femoral stem, ceramic head with metal cup in a ceramic shell. Ceramic is a good option because ceramic heads are very difficult to scratch. The hard, scratch-resistant, ultra-smooth surface can reduce the wear rate when used with a polyethylene cup. How is the procedure done? The surgeon exposes the hip joint and dislocates the ball from the socket. He removes the head from the femur, thigh bone. He then reams away the surface of the socket. The surgeon secures in place a prosthetic cup, socket. The surgeon then secures a metal head, ball, and stem into the femur, either by a press fit or with bone cement. He places the ball into the cup and ensures range of motion. The surgeon then closes the incision. After the procedure, in general, most individuals after hip surgery are discharged after 4 to 10 days provided there are no complications. The first night, you will be confined to bed with a wedge-shaped pillow between your legs to keep the new hip joint in place. Rehabilitation with exercises is an important part of post-operative care. The physiotherapist assists the patient with exercises for strengthening, gait training, and improving circulation. Precautions after surgery. General rules of total hip replacement that the patient needs to follow are: in the first 6 to 8 weeks after the operation, patient must avoid bending the hip beyond 90 degrees. Sitting on a small pillow can help with this positioning. Avoid sitting in sofas or couches which may cause excessive bend at the hip. Avoid bending over from the hip to reach the floor. Avoid crossing the surgical leg over the non-surgical leg. When sitting, it is good advice to keep the legs 3 to 6 inches apart. Avoid turning the operated leg inward. What can I expect after a hip replacement? The person with a hip replacement may be able to take part in physical activities that were impossible before surgery. For routine physical activities, it is better to consult your surgeon. Most individuals following hip replacement surgery are able to return to work within a month or 2 of the surgery, unless the work involves repetitive climbing or crawling. Overall, many find that the activities that were once painful, such as climbing up and down stairs, sitting for extended periods of time, and getting in and out of cars, can now be performed with less pain. What are the risks and complications? As with all major surgical procedures, complications can occur. Some of the most common complications following hip replacement are deep venous thrombosis, DVT. To prevent this, your surgeon will prescribe blood-thinning medication to prevent clots from forming. Infection. A small number of people can develop an infection with a total hip replacement. You may require further surgery to remove the prosthetic components and clean out the joint, along with a course of antibiotics lasting 6 to 8 weeks. Nerve injury. You have a small risk of injuring the nerves that allow sensation and movement of your leg. Often this problem, if it occurs, will go away over time.